At JRI, our mission is really to provide any service we can related to social justice, looking for the gaps in social justice and figuring out ways that we can do it better. Most of our services are related to supporting people who have been through significant chronic trauma or have mental illness and figuring out how to best help them move forward and have their own long-term independence. We're really committed to making sure that when we're serving these families and supporting these families, that we're doing it using cutting-edge clinical interventions, making sure we're doing whatever is going to work. And so part of that is new practices, new research. So we have a full research team and a full data system so we can make sure it's working for each individual, the family, but also on an aggregate level.
CATS is an internally developed web-based platform that we use to track our clients' outcomes over time. We have this individual level feedback that our clinicians get on how clients are responding to treatment, identifying client needs, making important treatment decisions and differential diagnosis. It also aggregates that data on the back end so that we can do benchmarking and quality improvement projects to improve services and make sure that we're servicing everybody equitably at JRI. And then the last role is really for research and to understand in a naturalistic clinical setting what works best for who so that we contribute to the larger educational field as a whole. CATS is a really interesting tool because it works really well for supporting research projects. So we can collect all types of data and then easily import those files into data analytics programs, and we can conduct all types of research.
The Institute for Dissemination, Evaluation, and Advancement of Trauma-Informed Care is our research hub at JRI, and it has several different areas of focus. The first is evaluation, and evaluation is essentially using data to examine research questions or the efficacy of our practices. The dissemination component is exactly that, taking what we learn and taking it outside of our own organization, out to the broader field, so that might be publishing a paper, that might be presenting at a conference. And finally, the advancement of trauma-informed care component, our lofty goal to take the information that we learn here at JRI out to the broader field and hopefully to influence policy and practice beyond our own system. One way that internal evaluation work at JRI has resulted in research that we put out to the broader field is a couple of years ago we did a study looking at clinical symptoms and how they changed over time among clients in our congregate care settings. On 5 out of 6 different indicators that we measure, which look at kids' mental health, so things like depression, anxiety, dysregulation, post-traumatic stress, kids in our congregate care settings were getting better, significantly better over time. And we think part of the reason for that is because we take a holistic approach here to kids' treatment. So we're using trauma-informed approaches, and we're training not just our clinical staff in those approaches, but all of our direct care staff.
The training team at JRI really focuses on trauma-informed organizational change. So we really have individualized trainings based on the needs of the program or the agency that we're partnering with for training. We really try to build upon their strengths and things that they're doing that are going really well and help identify some areas where they could be more trauma-informed. So different members of the training team focus on different aspects of that organizational change. We really work with our close agency partners like DCF and DMH and DYS, but we also work in settings like school systems, we work with law enforcement, and we work with groups that are really just trying to better support their staff in working with marginalized communities.